Welcome to today's press briefing. We have with us today Dr. Chong Sok Kwan, Head of Communicable Disease Branch, CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. The two doctors will bring us up to date on the COVID situation in Hospital Authority. Dr. Lee, please. We have 2,759 patients in hospital for COVID, 313 are new admissions, 469 are in isolation wards, 197 in the second tier isolation ward, 587 in North Lantau Hospital ICC, and at the AWE there are 239, 223 are new admissions. Yesterday we have reported 10 critical patients, 4 with 4 shots, 2 with 3 with 2, 1 with 1 shot, and 1 with no record of vaccination. 8 patients in serious condition. Of the hospitalized patients, 54 in critical condition, 59 in serious condition. 15 of the critical patients are in ICU for treatment. For the deceased patients, we have reported 11 cases, 7 male and 4 females, 50 to 100 years of age. 7 of these patients have not completed 3 shots of vaccines. 5 didn't have any record of inoculation. For these 11 deceased patients, 5 are believed to be related to COVID and 6 are uncertain or unrelated. I'm going to go into detail in a moment. 74-year-old female, no vaccination record, Parkinson's disease, and dementia. She was admitted to Kwong Wah A&E, high fever and shortness of breath. She suffered from pneumonia from X-ray on 17th. She tested RAT positive. At the A&E, she was intubated. Her condition, she had other heart conditions and poor renal function. On September 7th, she passed away. 87-year-old male with 2 shots, heart condition, hypertension, and she was admitted to A&E with pneumonia. She tested RAT positive on September 7th. He passed away. 93-year-old male with 2 shots. He was admitted to Caritas Medical Center, and he suffered from high fever and poor condition. On 2nd of September, he tested RAT positive, and the PCR test also came back positive. His condition deteriorated and passed away on the 8th. 88-year-old female, no vaccination record, with a stroke history. She was admitted to Princess Margaret Hospital with pneumonia. RAT PCR positive. Her condition deteriorated quickly and she passed away that afternoon. 84-year-old male with no vaccination record with stroke history. He was admitted to North Lantau Hospital for shortness of breath and unconsciousness. And when he was admitted to the A&E, he suffered from pneumonia. He was intubated because his respiratory system worsened and passed away on the 8th. And there are 4 patients who we believe to be unrelated to COVID. The 6th, 84-year-old male with 3 shots with TB and atrial fibrillation. He was admitted to Kwong Wah A&E with fever and shortness of breath. His conditions were stable on the 1st of September, starting from September 1st. His white blood cell rose pretty quickly. He was probably suffering from some problem with the intestines and leukemia, and he passed away on the 7th. 93-year-old female. She was admitted to North District Hospital. Her condition was stable, but on the 8th of September, she suffered from a shock and she passed away in the morning. 54-year-old male with 3 shots. He traveled outside Hong Kong and he was admitted to UCH, suffering from abdominal pain, and he had some problem with his liver and also sepsis, and he passed away on the 8th. 95-year-old male, no vaccination record, with dementia. He was admitted to Zhongguan Hospital. He had some necrosis on his feet. RAT test negative, but PCR positive. The CT value 28. He had some pleural effusion because of his feet problem and the lung problem. He passed away on the 8th. There were 2 uncertain cases, and they were pronounced dead in the A&E, the 10th patient, 100-year-old female, arrested from a care home, no vaccination record. On September 8th, she was submitted to QMH A&E. She was unconscious. She didn't respond to resuscitation, but from the RAT test, she tested positive. 11th, one 85-year-old male with 3 shots. He suffered from cancer. And on 25th of August, he tested RAT positive, and on the 29th of August, he tested PCR positive. He's been to a designated clinic. He was unconscious and was taken to Caritas Medical Center by ambulance, and he passed away on the 8th of September. Over the past day, 336 patients recovered, 224 have been discharged, 3 patients were picked up upon admission screening, 6 patients listed as close contacts, 138 staff members tested positive, and 79 staff members have returned to their posts. I'd like to make a plea here regarding the vaccination of children. The COVID situation is getting increasingly serious, and after schools have commenced, there are more cases of infection among the teachers and students, and we are concerned about that. We have seen some statistics. Since the 5th wave, 110,000 students have tested positive for COVID, and 8 students unfortunately passed away. I mean, we don't really want to see this happen ever again. Looking at the August admission figure, those below 3 COVID positive patients, 25%, 1 out of 4 need hospitalization. At its peak, we had 160 positive children were hospitalized, and 20 serious or critical cases were recorded. This is imposing a burden on the public health care system. And the children don't have a good awareness of the hygiene protocol, and that there is a high risk of transmission and infection. So vaccination is the best way to guard against COVID, and this would also mitigate the risk of infection and also the side effects as a result of infection. So we encourage the parents to vaccinate their children as soon as possible and to guard against the possibility of contracting COVID. Yesterday, local positive cases, 9,922, 2659, PCR positive, 7293 RAT positive. 154 imported cases, 136 PCR positive, and 18 RAT positive. Of 154 imported cases, 63 were picked up at the airport, and day 1 to 3 and at the quarantine hotel and quarantine centers, we picked up 53, and day 4 to 7 from the community center, we picked up 34 cases. Day 8 to 10, there were 4 cases. Of these 54 cases from 36 places, 5 imported more than 10 cases, the Philippines, the US, Thailand, the UK, and Canada. And also for the other 31 places, they imported less than 10 cases. As Dr. Lee said, we have received 10 deceased cases in the 5th wave. We have seen 9,567 cases of fatality. There are 7 care homes and 3 RCHDs that reported 11 residents who tested positive, 43 residents have to be subject to quarantine. And these centers in the Eastern District, Phong Lo Care Home and Kowloon City, Tai Zhong Care Home, Wong Tai Sin 6 Yuen Ho Yam Care Home for the Elderly, in Kwai Chung San Man Phúc Care Home, that's in Kwai Chung Branch, Yau Chuen Mong Wing On Care Home for the Elderly, and in Kwai Chung Wing On Care Home for the Elderly, and also in Kwai Chung Chung Yue Yuen Kỳ Yin Care Home cum Daycare Center, in Twin Woods a New Life Care Home, and in Kwun Tong Hong Kong Mental Association, Dun Lok Hin, and in the North District, Yen Chai Hospital, Ho Tak Sam Care Home.
For schools, today is Friday. We've received 707 school reports on 1,171 positive cases, affecting 984 students and 187 teaching staff. The positive cases came from 147 nurseries and kindergartens, 288 primary schools, 260 secondary schools, and 12 special schools. In the past 7 days, 530 schools have reported 2 or more cases to us. Today, we have proposed to 22 schools that 22 of the classes should be suspended for 1 week. They include 5 nurseries and kindergartens, 9 primary schools, 7 secondary schools, and 1 special school. We had suspended classes in 3 schools, and in those schools, other classes also had to be suspended for a week. They include South Island School, 9K class in the high school session, where 3 students tested positive. In Waterloo Road, Yu Chung International Kindergarten is another one. It's ITLP2 class. It has 13 students. 2 of them tested positive. One student and 1 teacher were infected, and the class had to be suspended for a week. And also, Shim Shui Po Shenzhen Primary School is P4L school, a class which has 24 students. Of them, 5 tested positive, and the class had to be suspended for 1 week. And in terms of virus strain, on September 9, we received a sample, that is today. Well, the sample received lately, the proportion of variant BA4 and BA5 made up 72.9 of all cases. That is 90% of them were of BA.5. So in other words, 65.6% of the overall cases were affected with BA5, and BA4 7.3%, and the remaining are BA from 12.1, which make up about 4.3% of the cases. On vaccine pass, well, there may have been some misunderstanding. For children who don't have an electronic vaccination record, they can use paper record, 2D vaccination record. And if they have the 2D record or through the healthcare electronic record, they can download it to their parents' mobile phone. And also, right now, we are following up on cases of individuals who violated the quarantine order, that is, during the infection period, and since the vaccine pass shows a red code, and yet they left the place of quarantine, and some even tried to enter premises regulated by the regulations, like restaurants. So we are following up on 40 such individuals. We're trying to collect evidence now and carry out criminal investigation. We issued summons to 3 of them already, and they may have violated CAP 55A or CAP 559F or A. So should these people leave the quarantine or designated quarantine sites during the quarantine period, that's in breach of the law. Authorized officers, including police and staff from the Department of Health, they are empowered to take these people back to the quarantine facilities. If they refuse to cooperate, that would mean an offense. Once convicted, they could be fined $10,000 or imprisoned for up to 6 months. So I urge the public to cooperate and not to break the law. So that's the end of my report today. Now it's time for questions. Before you ask a question, please tell us which media outlet you're from. On the right, lady in the front row. Thank you. I'm from TVB. On the Leave Home app, the newly added function to verify the vaccination record is that people don't need to show their ID card to have their vaccination record verified. Are you worried about any fraud or cheating? Well, I think this is a newly added function that provides convenience to people in terms of registering their information, but they will need to show their evidence, and so they can actually show the evidence to ensure that, for example, show their telephone number to the person checking the document. You can look at the press release, it gives ample details. Next one, please. I'm from Now TV. On the 100-year-old female, you said that it's not certain whether it's a COVID-19 case. Did she have any chronic diseases? I know that she tested positive in RAT. Where she stayed, the residential care home, any other residents there were affected. And also on the vaccine pass, the deadline for 3 jabs November 30th is under 3 months. If the child or children concerned have not yet been vaccinated, so what can they do? Do they have enough time? And also, are you thinking that more schools might have to suspend classes as the number of cases rise? For schools, the cases in the community, there are quite a number of them. So I think about 10% of the people in the community do have to go to school or work in the school environment. So if there are more cases found, then we would expect that some of these people might test positive before they go to work in school. And as for whether the gatherings in schools, we'll see what will happen. Sometimes cases in the school, say the school with 1,000 students, there could be a number of cases confirmed each day. So we'll see whether the cases are concentrated in one class or on the particular days, or discovered in the particular days. So that would tell us whether the chance of spread in the school is high or not. If there's a sign of outbreak in the school or in the class, then we'll ask the class or school concerned to suspend classes. If a school actually has more classes with infections, then the whole school may have to be suspended to avoid an outbreak. As more cases emerge, I think whether it's the spread of the virus within the school, or it just so happens that there are just large number of students in the school, or the chances of infection could rise. As for vaccine pass, for the safety of children and other people, I think when they enter high-risk premises or engage in high-risk activities, they should be fully vaccinated. Well, there's still time for them. Whether it's for BioNTech or Sinovac vaccination, they can have 2 jabs within 1 or 2 months. We hope that children can receive the jabs as soon as possible, so parents can take them to receive the vaccine. As for the 100-year-old female patient, I may not have made myself clear. She was not vaccinated. She lives in a residential care home. I don't know I don't have the information on which care home she stayed in. She had a history of stroke. On August 26th, she tested negative for RAT, and she was admitted into Queen Mary Hospital. On September 5th, she was discharged. She was in stable condition, and the RAT came back negative. So we followed the guideline. But on September 8th, she fell unconscious in the residential care home and was rushed to the A&E department. And RIT also came back negative. So she tested negative for RIT when she was admitted into A&E. We performed resuscitation, but it was useless. So on the night, she passed away.
Next, please. A lady at the back on the right, please. Doctors, your organization, Cable News, 93-year-old patient with 3 shots admitted to North District Hospital. It is believed to be unrelated to COVID. Is she a chronic patient? And on September 8th, she suffered from a shock. And also those below the age of 11, the cases are rising in number. Are you going to suspend classes? No. At what level of the caseload will you be suspending the classes at school? We don't have any magic number as to how many cases there will be for suspension. As I said earlier, there are more cases from the community, and as a corollary, there are more positive cases in school, and there are something like 700,000 students and 100,000 staff members, and that's about 10% of the total population. If we have 10,000 cases in Hong Kong, there may be 1,000 cases testing positive before they go to school. If there is any congregation in certain classes or in certain schools, if there are more classes, we would advise certain classes or certain school to suspend the classes. Now, we have been implementing these measures for a couple of months, and this has proved to be effective in curbing transmission in schools. We will keep this measure on. 93-year-old female with 3 shots of vaccines. She suffered from high blood pressure, hypertension. On August 28th, she was admitted to North District Hospital for dizziness. She tested RAT and PCR positive. All along, in the course of treatment, her condition improved, and there was no case of pneumonia. On September 8th, she suffered from a shock. I cannot say categorically 100% that this is not COVID, but it seems to be more like a heart condition. Lady over there. Orange News. HA, the 50-year-old male who passed away. You said that he had travel history. When he came to Hong Kong, did he turn up at the A&E, or did he wait a little bit before he turned up at the A&E? And at the A&E, what is the CT value? After he tested positive, was he prescribed any antivirals? And Dr. Lee, a couple of days ago, you mentioned AWE. After the Mid-Autumn Festival, there will be further supply of hospital beds. How many more beds are you going to be making available? And what is the staffing ratio at the AWE? And how many more beds can you increase by maximum? And 6P, what is the sewage surveillance? Any data regarding the average viral load from the sewage surveillance? And during this autumn festival, do you have any plea for people to guard against the transmission? Right, the 52-year-old male, he had travel history. He had discomfort at the airport. He suffered from abdominal pain and hypertension, and on August 31st, he was admitted to UCH. He tested RAT and PCR positive with high CT value. We found that the problems lie with the headache more, and from the clinical evidence, he suffered from enlarged liver. We had some scan, and there are some problems with the liver, and he needed some adrenaline, and he seemed to be suffering from sepsis. And on September 8th, he passed away. AWE, At the present moment, there are 240 beds. We are closely monitoring the COVID situation and the demand thereof. We do have planned, perhaps after the Mid-Autumn Festival, to increase the number of beds to 280. In terms of healthcare workers, there were 17 doctors, 88 nurses. Sewage surveillance, the recent figures seem to be 500,000 to 600,000 copies per litre. There's half a million or 600,000 copies. This number is really on the high side, similar to what was happening back in March. Now, during the Mid-Autumn Festival, there may be activities planned for the event. I think we should avoid mixing of family members, because COVID is about human-to-human transmission. If there are many mask-off activities, if there is a congregation or gathering, there is a higher chance of transmission. In particular, when there are elderly people and children who are unvaccinated in the gathering, they are at high risk. Obviously, if there are gatherings with a lot of people, we should consider having the RAT test beforehand, because we're all encouraging RAT test. If one tests RAT positive, one should report it and cease the activities. If one has undergone RAT but is negative, but he's suffering from sore throat, headache and fever, because the RAT may not register positive straight away. If someone is suffering from discomfort, they should refrain from attending these activities because there is a chance of transmission. Any further questions? Let's make it the last question. The lady at the back, please. Mingpao Daily. Today, there are some classes that have to be suspended. Are they related to the schools reported earlier in previous days? And 160 children were hospitalized, and 20 or so serious or critical conditions. And this is less than 1 or 10% of the total number of COVID patients in hospital. How is it that it's creating burden on the hospital? Now, for these cases, 160 and 20, what are the age ranges, and what is the bed utilization rate? And also the vaccine pass for children. The age threshold has come down. What about the HA premises? What about the compassionate visitation for children under the age of 5? Do they have to fulfill the vaccine pass requirements? Right, let me take the question first. You're asking about the 3 schools where there were some classes that have been suspended. Are they related to today's classes? We don't see any particular link, albeit some of them from the same school. The vaccine pass. Now, for the medical premises, we will follow the vaccine pass requirements. Vaccination is terribly important, in particular for the elderly, the children, and the people with underlying conditions. This can prevent any complications. As medical bodies, we are people-oriented. In particular, we are patient-oriented. We would give special considerations. If people experience any difficulties, please seek assistance from our staff. And the public hospital will exercise flexibility depending on the circumstances. As to the children, at its peak, we have 161 children who are hospitalized for COVID. And as I said, there are 20 children who were in critical or serious conditions. The key thing about the data is that, notwithstanding the small number, if 1 in 4 pediatric patients are turning up at the A&E, they will be hospitalized, and when they are in hospital, they would create a burden. And in terms of numbers, the pediatric beds are smaller in number than other beds. And we have to activate certain contingency measures and convert some of the adult wards into pediatric wards. And we will deploy the staff members to handle the situation. So in terms of the number of wards and beds, this is really filling us with concerns. Right, that's all we have time for today. Thank you all very much.